Hi, I'm Andy Berkowski, MD of ReLACS Health, and I wanted to talk about why your restless legs might be getting worse. Well, there are several main reasons. Number one is the medications for restless leg syndrome might actually cause you to get worse. This is the number one reason. If you're on a dopamine agonist, pramipexole, rotigotine, ropinirole, or even levodopa, over time it causes what we call augmentation, which means that the symptoms will come on earlier at night. They might become more severe and you'll need higher and higher doses and the condition gets worse. This is a very difficult situation and usually requires medical help in order to address. So if you're on a dopamine agonist, it's probably getting worse because of the treatment, not because of other reasons. Number two is iron deficiency. Restless leg syndrome is fundamentally a condition of low iron levels in the brain. So if you lose iron by not eating enough iron, by not eating enough meat or red meat, which has the most absorbable form of iron, or if you're losing blood, whether it's through menstrual periods or through your bowels or an ulcer in your stomach, that could be a source of iron loss. And you need to get your iron levels checked. You need a fasting ferritin and percent transferrin saturation checked in the morning. And you want that ferritin level to be above 100 and that transferrin saturation to be above 20%. Otherwise, supplementation might be very helpful. The third reason is maybe someone, a doctor, a provider, or you yourself have added an anti-drug. What are the anti-drugs? Anti-nausea, antidepressant, antihistamine, antipsychotic. All the anti-drugs tend to make restless legs a little worse. One of the big culprits are the antihistamines, not the newer ones, but the older ones like Benadryl. If you take an over-the-counter sleep aid, it may have a chemical called diphenhydramine or doxylamine, which are older generation antihistamines that make you drowsy, but these could trigger your restless legs. Adding an antidepressant may change the course of your restless legs, and that could be something that may worsen the condition. A fourth common cause of restless legs getting worse is poor sleep hygiene, a poor sleep schedule. Restless leg syndrome follows the biological clock, and if your biological clock gets disrupted, your sleep quality starts to deteriorate. Your restless leg syndrome could get worse. So keep an eye out for those symptoms emerging because of changes to your sleep patterns or your sleep habits. For more information, you can go to my blog at sleeprls.com/blog. As a reminder, this video is for medical information only and does not constitute the practice of medicine. So please make all healthcare decisions with a licensed healthcare provider. And please remember, one of the keys to sleeping well is to relax.